Hello, everyone, and welcome to the American Society of Regional Anesthesia and Pain podcast, ASRA Wrap. I'm your host, Raj Gupta, coming to you from Nashville, Tennessee, and I am really excited to have some great people on today. We're going to be talking about the ASRA spring meeting coming up just in less than a month in Hollywood, Florida. This is going to be a great meeting, so I want to jump right to it. We're not going to do a bunch of announcements or anything because what I really want you guys to hear about is the meeting. So let me bring my guests on. We have, of course, our meeting chair, first and foremost, Steve Haskins. So I'm going to do quick intros for all of you guys. So bear with me because I have some wonderful stuff to say about you and I want everybody to hear it. So Steve Haskins is a regional anesthesiologist trained at the Hospital for Special Surgery in New York. And during his fellowship, Dr. Haskins developed an interest in point of care ultrasound, which we're going to talk about today, specifically focused on cardiac, lung ultrasound, abdominal ultrasound, gastric ultrasound. And Dr. Haskins is the co-founder and chair of the ASRA Pain Medicine Perioperative POCUS Special Interest Group. He's also the lead author for POCUS for the Regional Anesthesiologist and Pain Specialist Review Series in Regional Anesthesia and Pain Medicine. And he is, of course, our meeting chair for this meeting. Welcome, Steve.
Thank you so much for having me. It's an honor to be here and so excited to talk about this meeting that's less than a month away, which is hard to believe.
Less than a month, man. Less than a month. All right, we're going to get to that in just a second. Let me introduce Stephanie here. Stephanie Cheng completed her anesthesiology residency at Yale and her regional anesthesia and acute pain management fellowship at Hospital for Special Surgery. She's also a board-certified medical acupuncturist and serves as the director of the perioperative integrative medicine program at Hospital for Special Surgery, where she successfully integrates medical acupuncture in the perioperative setting. Her primary interest is the optimization of patients undergoing orthopedic surgery and the integration of non-pharmacological novel modalities to improve perioperative outcomes. Stephanie, welcome. How are you?
Hi, good. Thank you for having me. Thanks, everybody, for joining us.
Yeah, and next up, we've got Gary Schwartz. Gary is the director of the acute pain management at Maimonides Medical Center in Brooklyn, New York. He's a board certified in both pain management and anesthesiology. Dr. Schwartz completed an interventional pain fellowship at Mount Sinai School of Medicine after finishing his anesthesia residency at St. Vincent's Hospital and Maimonides Medical Center. He received his MD from the State University of New York Upstate College of Medicine and graduated magna cum laude from Union College in Schenectady, New York. He focuses on back pain, neck pain, and spinal cord stimulation, nerve pain, joint pain, and failed back surgery syndrome. At Maimonides, he focuses on assisting hospitalized patients with post-op pain, but also educates anesthesia residents and med students. He's currently serving as a committee member for ASRA Pain Medicine and the American Society of Anesthesiology. Welcome, Gary.
That was a mouthful. Thanks for having me, Raj. And
I know.
Look forward to the ASRA spring meeting.
You're such a regular on this thing. I'm getting good at your intro, so we're going to get better and better at that. And then I think I've got Angie Saeed here. Angie, how are you?
I am good. How are you? Thank you for having me.
Good. She won't be able to join us on camera, but we're so excited to have you here. Angie is an associate clinical professor in the Department of Anesthesiology at UC San Diego and serves as the director of the acute pain service. She completed her medical degree at UCLA, followed by anesthesia residency training at University of Southern California and UCSD. She then completed regional anesthesia and acute pain fellowship at UCSD in 2014, and her research interests center around acute pain management, opioid-sparing modalities, and novel regional anesthesia techniques, including neuromodulation and cryoanalgesia, which we'll be talking about today. We have such a great group here. Angie, thank you for joining us. I'm so glad. I know everybody's got a busy clinical day, and they're juggling a lot of things, but this meeting is coming fast and furious, and I want to make sure people could hear about all the great stuff that has been put together. You guys have been doing an amazing job. And Steve, I'm going to start with you because as someone who's done this before, I can attest to the fact that it seems like forever planning this meeting, and then you can't believe it's almost here.
Yeah, well, it's what's remarkable about ASRA pain medicine is that they really put a lot of time and effort into ensuring the success of the meeting chair. And what I mean by that is that they asked me to chair this meeting back in 2019, and I've had many years to think about it and put it together and see different iterations of it and get feedback from the many members on the planning committee. So yeah, it's a huge undertaking for the society, and they invest a lot of time and effort in us to ensure that we get the most out of this experience and that the meeting is a success.
So let's start with the big thing that we need to kind of start out with, which is this is the 100-year celebration for the American Society of Regional Anesthesia. Why don't you talk about this a little bit? Because there's a specific 100-year anniversary we're celebrating, and I think it's important to know that distinction.
Yeah, so the meeting theme for this year is 100 Years of Regional Anesthesia, a century of innovation and a future of inclusivity. And so the 100 Years of Regional Anesthesia speaks to the original formation of the American Society of Regional Anesthesia by Gaston Labat in 1923. And so after publishing his landmark book on regional anesthesia techniques, he and several colleagues formed the original American Society of Regional Anesthesia, the original ASRA, that was an important sort of step in terms of creating the infrastructure for anesthesia societies and MD anesthesia societies across America. Within a few years, the group actually disbanded and joined the original ASA. And so it wasn't until approximately 50 years ago, in 1975, that our current American Society of Regional Anesthesia, now ASRA Pain Medicine, was formed. And so we are celebrating Gaston Labat and his 100 years of innovation, and the fact that our society has been making sure that regional anesthesia and pain medicine has been at the forefront of our specialty for 100 years.
That's fantastic. Now, if you guys are watching on video and you're astute, you realize there's one other person up here, Nadia Hernandez. Nadia, welcome.
Hi,
So
thank
let
you
me
for
do.
having me.
Yeah, I'm going to do Nadia's quick introduction here. So Nadia completed her anesthesia residency at the Icahn School of Medicine at Mount Sinai Health System in New York, followed by fellowship training in regional anesthesia and acute pain medicine. She moved back home to Texas, where she serves as an assistant professor of anesthesiology at the University of Texas at Houston McGovern School of Medicine. Dr. Hernandez revamped the entire regional anesthesia fellowship and was promoted to director of regional anesthesia at UT Houston, as well as program chair of the regional anesthesia and perioperative ultrasound fellowship. She's one of the co-founding members of the ASRA Pain Medicine Perioperative Point of Care Ultrasound Special Interest Group. And if any of you guys pays attention to anything going on in this field, you see Nadia everywhere. She's doing a lot of great stuff. Welcome, Nadia. Thanks for joining us. So let me get to one of the really cool things that you guys have put together. There's so many cool things, and we're not going to have enough time to talk about all the really interesting, cool things that you guys are doing at this meeting, and that the people attending are going to be able to take advantage of. So first off is I'm going to have Stephanie talk about this topic here. So Stephanie, one of the new things here is this complementary acupuncture and hypnosis workshop. Tell me a little bit about this.
Can you hear me? Okay. So, hi everyone. I'm Stephanie. Thank you, Raj, for that introduction. And yeah, I think we're going to have a really, really fun time here in terms of our new workshop with acupuncture and hypnosis. And the goal of the workshop itself is not necessarily to teach you, the whole history of acupuncture or the whole history of hypnosis in the perioperative period, but sort of give you a taste of what it might be like to, and what it might look like to incorporate it and integrate it into the perioperative period for your patients. The thing that we run into a little bit is sort of state regulations and what is and is not allowed by MDs who only have an MD and don't have an acupuncture certification or license. But our goal is for those that are able to, is to be able to take what they learn from this workshop, auricular trauma protocol, enhanced auricular trauma protocol with the addition of electricity to help with postoperative pain control in patients who are undergoing orthopedic surgeries or surgeries that don't require general anesthesia. So any sort of MAC procedure, and really be able to utilize this protocol and help get patients through their surgeries. The hypnosis part is even newer. Dr. Megan Kirksey will be leading that part, and she's just going to give a little bit of a taste of what types of hypnosis techniques are out there and what it might look like in terms of being able to use it with patients to help with anxiety and in the perioperative period.
Yeah, I don't think we've done anything like this before at the spring meeting. I know some of the discussion of alternative therapies have come up in the chronic pain meeting in the fall, but I think that we're seeing a merger of a lot of acute and chronic pain topics, and this is one of them, that there's more and more people introducing this in the perioperative space and trying to find ways of helping people minimize opioids. I think it's going to be really exciting to and this is not just a lecture, this is a workshop. People are actually going to learn some real skills there. I encourage you, if you haven't already, go to the ASRA.com website, go to your registration. If you're not registered for the meeting, well, that's an obvious first step. But then go into the workshops and sign up for these things, because they do fill up really fast, and I don't want you to get excited about it and then there's no spaces left open. The more interested you guys are, the more we'll include this stuff in the future too. So let us know what you think about this. The other one there's a couple of these things where we're starting to intersect between acute pain and chronic pain. NG, you want to talk a little bit about the cryo workshop? I'm going to put this up on the screen for people to see. So, and I'll get you and Nadia to talk about this. This is both a workshop, and there's going to be some lecture material on this too.
Yes, thank you for the introduction. This was very much led by Dr. Hernandez. So this was her idea to bring forth cryoneurolysis and make it hopefully more accessible and less intimidating for our colleagues. Our plan is to have 4 stations and to highlight the superficial sensory nerves that can be easily accessible by cryoneurolysis. And then we'll have some cryo machinery. And we'll also explain the differences between the several needle sizes and probe variations. Dr. Hernandez, do you want to chime in on more details as well?
Yeah, I think,
so Nadia, tell people a little bit about what cryo is and why you guys are even talking about that. I think that's a really important thing, is because people might think this is a chronic pain thing, and why do acute pain physicians need to know about this?
Yeah, so we started, I think the reason we thought about doing this workshop in the first place is because we get requested to do a lot of grand rounds on this topic, because it is new and emerging in the acute pain world. It's been done for chronic pain for several years. I think some of the newer devices are starting to look more and more like an ultrasound guided block, a needle with an ultrasound, but instead of injecting local anesthetic now, we're making little ice balls by the nerves and causing layering degeneration, which kind of can provide analgesia for an extended period of time. If you have the right patients for this procedure, it's really beneficial. Instead of trying, we have problems with our catheters, arguing over how long to leave them in for certain patients in our institution. And this is one way that we've been able to provide a longer lasting analgesia for those patients. So I think the fun part about this workshop is that we are going to go over how to find some of these obscure nerves that even other regional anesthesia experts kind of pull me aside and say, can you show me how to find this nerve? Because it does take.
We're getting to the smaller, little tiny nerves, the ones that we can't find in cadaver lab because we already cut them because we didn't know we were looking for them in the first place.
Yeah, and you can see them with or the regular ultrasounds that we use. It's a matter of tracking them, and like Angie said, it can be intimidating if you've never done it before, and if you don't do cryo and you didn't train during cryo, well, how do you learn? Right. Other than having, a rep come over and teach you should really learn from people who are doing it already. And I think this workshop is great for anyone who wants to start doing cryo or even wants to consider it, because we'll go over how to use the different devices and how to choose your patients.
Can you give me an example of one or two of the nerves that you guys target with cryo? This is new to me too. I mean, I haven't done it myself, so I'm, if I weren't so busy at the meeting already, I'd be attending the workshop myself, but I don't have time in my schedule to do it. They got me running around everywhere already.
So I'm an anesthesiologist at a trauma center, and so we have a protocol where we cryo the lateral femorocutaneous nerve sort of inside the pelvic brim. So you can actually see it. A lot of people, when they do like an ultrasound guided block, they're just using landmarks and they're saying, oh, it's right here in this fat-filled tunnel. And sometimes they're pointing at the nerve, but not always. But, depending on how you tilt the ultrasound, you can trace the nerve. The nerve starts to divide right away. And once you see it sort of going inside the pelvic brim, sort of above the ACEs, you can isolate it and cryo it. It's very interesting, actually, because now that we've been doing cryo at this level, it's interesting to see the pattern of innervation and how it varies from patient to patient. And a lot of times it really does provide analgesia to almost the entire knee, which, depending on what you read, can be different nerves. And as we started to cryo the LFCN, at least at my institution, we have a protocol where we do it for all the burn patients that are getting skin grafts. So if they're coming to the OR, we cryo them pre-op, and we mark the area that's numb, and then the surgeons will take the skin graft from the numb area, which we have some of our physiatry physicians involved, and we're studying these patients to see if it's actually improving their ambulation post-op, because what happens with the skin grafts is once they take the skin graft, they tend not to walk. They don't want anything to rub against it. And so they end up laying in bed for a long time. So that's kind of what we use it a lot for. We also found for sometimes when they don't consult us pre-op and they call us afterwards, there's patches of skin, medial to the area. And so we've had to find sort of these branches of the medial and intermediate femoral cutaneous nerve and their anterior femoral cutaneous nerve. And so, that's being published at the moment, but they are easy to trace off. And you can actually, when you see the femoral nerve, you can identify parts of it that give off certain branches and then follow them through. Sorry, I'm long-winded.
No, it's okay. I mean, it's fascinating because, again, we're taking stuff that we've learned, like the basics of, and then we're just going, like I said, smaller and deeper. And, we've always joked around about how, opioids are the big guns, the big cannons that we're attacking people with, and we're trying to get to epidurals and spinals, which are our sort of shotgun approach, and we're getting to sniper rifles. I mean, you guys are like on blow darts now. I mean, it's micro nerve targeting, and trying to really get to this very, very specific place where we're really getting the sensory effect and saving a lot of the other motor and functional aspects, and then also adding duration to it. So if you want to hear Nadia keep talking about this stuff, you go sign up for the workshop, and she will fill your head with all kinds of ideas, so that's I mean, that enthusiasm is what gets everybody excited, so that's awesome. I want to yeah, we lost Angie for a second here, but she'll be there too.
So
say it again. Sorry, I interrupted you. Go ahead. No, I couldn't hear you,
I was
Nadia.
just
Go
saying
ahead.
that's what we use it for. Can you hear me now? Am I saying?
Yes.
I was saying that's what we use it for here at Herman, but at UCSD, which they really pioneered a lot of this literature. They're going to be using it, or they're using it for joint replacement and knee pain and stuff like that. So there'll be a lot of different stations, and for mastectomy as well. They're using it for that there. There'll be a lot of different stations to learn how to use it in your practice. But anyway, that's how we use it at Herman.
So let's talk about another crossover. So this is another one where, so Gary, I'm going to have you talk about the fluoro aspect. So again, bringing information, skill sets from the chronic pain world. And as I said in your intro, you do both acute and chronic pain, and using techniques that have been sort of intimidating to those of us who are doing anesthesia and acute pain, is bringing fluoroscopy into some of our techniques. And I know Dr. Seitz has mentioned to me that he has been doing fluoroscopic guided epidural placements for every one of their patients at Dartmouth for several years now, and had really good success both in the logistics and the quality of care. Talk to me a little bit about this workshop, Gary.
So I'm pretty excited for this. Thanks for having me, Steve, and incorporating this into the program. We're having a lot of this transitional pain as we're incorporating the chronic and the acute together, almost like transitional. We're incorporating fluoro. So fluoroscopy is X-ray guidance, which has been very commonplace in the pain medicine world and at the fall meetings. So you could actually see the epidural space. You could see either with dye, you could see that you were in the correct area with different views, contralateral oblique, AP, lateral, fluoroscopic views, and you could actually see what level your catheter is at if you're going to do an indwelling catheter, or sometimes in my practice for difficult epidurals, post-dural puncture headaches in the OB world for blood patches, we do under fluoroscopy a lot. So it's one-time stick, easy for the patient. They're lying on their belly, making it more comfortable, or for difficult thoracic epidural like Dr. Seitz places, so you know at which level it's at, that we're in the correct area. So it's changing it. And just like with cryo, which we do a lot in our hospital as well for our total knee arthroplasties, we're looking for more than, hey, how can we get from 1 day of pain relief, 2 days, 3 days, to we're getting weeks and months so the patients could actually get a functional recovery instead of just going the blind old school approach, which we've all done hundreds and thousands of time and hope we're in the epidural space. Our literature shows that we're not always in the epidural space. We're not at the correct level. So with fluoro, you could actually see that, confirm it, potentially make it a better experience for the patient, for the procedure wise, but also to get the clinical care post-operatively. So I'm looking forward to this. It also helps with your epidural and spinal placements, just to see the anatomy under fluoroscopy. Hey, this is why we struggle sometimes. How does the transverse process look? Do they have short pedicles? How bad is their stenosis? And you could see why you struggle sometimes with our normal approaches. So I'm looking forward to being part of the faculty.
That's fantastic. So I'm going to ask you one question because I always struggle with this is when you start threading an epidural catheter, a lot of times the patient will, it goes in smoothly and then they'll have a one-sided block. Are you guys actually using fluoro-guided epidural placements to steer catheters to make sure that you're not one-sided, that you're not getting a unilateral effect, or is that still too tenuous to do that?
So in my practice, you could do that. In my practice right now, I save that more for my spinal cord stimulation patients,
sure.
my dorsal stimulation to get certain sides, or like RAS catheters type of procedures for the chronic pain. But when I have placed thoracic epidurals under this, I will give some dye to confirm the placement and make sure I'm getting spread on both sides. Or if it's like for like a VATS thoracic type of procedure or a trauma fracture, that I want to make sure it's getting to the side that we have the fractures. Another indication, which you should check out NG and Nadia's lecture, we have done, I know NG and her team has done a lot of work with mastectomies, also good for chronic rib fractures or polytrauma. The cryo of the intercostal nerves you could use to give them a lot of relief for post-op. Sometimes we do some rib plating. So we're going to have a lot of intersection between all the different procedures and imaging. You could access some of these areas.
Yeah, Angie, we lost you there for a little bit. You want to add to, so Nadia was talking about using it for some of the lower extremity procedures and then her being in a trauma center, the cryo. Do you want to talk about some of the stuff that you guys are using cryo for in UCSD?
Sure. So we've used cryo also in the settings of trauma and rib fractures, kind of like Dr. Schwartz mentioned recently, but we've also tried using it for TKAs. So we'll be demonstrating some of the nerves involved with that. And we've also obviously used it for our mastectomy patients. We're actually out of UCSD, they're running a much larger study patient population. So we'll do preoperative intercostal nerve blocks along with our paravertebral nerve blocks for these patients. I look forward to attending your fluoroscopy workshop as well and learning something from you there.
Always a pleasure.
See, all of you guys listening here, you have to sign up for these workshops fast because all of the people on this call are going to be filling up all the spots whenever they can. We're all learning from each other and we're all excited about this new stuff. And I think that's going to fill up all the spots really fast. So I don't want you guys to wait till the last minute. Steve, I'm going to come back to you because do you want to add something to those workshops there?
Well, yeah, I just wanted to say, this is it's exciting that we're bringing in these elements to the spring meeting, and anyone who's been following ASRA for the last few years, we moved from ASRA to ASRA Pain Medicine, and that's sort of what we're formally called now. And the reason for that is that in both the fall and the spring meeting, we're focusing on being pain medicine and management physicians in the entire perioperative session. It's not just being block jocks anymore, but it's thinking about sort of how we can have a meaningful impact on the pain management of our patients, both in the chronic and acute phase. So it's really exciting for us to be able to think about this at the spring meeting of these tools that have been used for many years on the chronic pain side are now working their way into the acute pain realm because they are just as relevant as important for patients in that setting.
So I would be remiss in not giving you a chance to talk about your personal passion, which is point of care ultrasound. We've talked about all this new stuff that you've put into the program, which is fantastic. And, point of care ultrasound was the new kid on the block a few years ago, and it was all the rage. But actually, you've done something really interesting. You've sort of incorporated it throughout the meeting instead of isolating it and really thinking about it as being an integral part of the meeting. You want to talk a little about how point of care ultrasound is going to be presented at this meeting?
Yeah, so I mean, obviously, as someone who has been a evangelist and a huge advocate for point of care ultrasound, if you're going to give me, a spring meeting to run, there's no way I'm not going to start working it into as many elements of the meeting as possible. And so, in addition to having it sort of be a part of our parallel sessions, and we have a nice interactive session as well. That Nadia will be a part of, along with Hari Kaligara and Jeff Gatson and Bridget Poulos. But we've decided that why shouldn't point of care be in every single workshop? And that's because we're currently primarily focusing a lot of our workshops on what type of blocks we should do for different types of surgery, right? Upper extremity surgery, lower extremity surgery. If you're doing abdominal, chest wall, sort of truncal surgery. And so each one of these areas of the body also have a meaningful point of care ultrasound skill that corresponds with it. If you're performing an upper extremity block, then you're most likely placing a needle near the pleura. So why not learn how to perform lung ultrasound to rule out an pneumothorax as a part of that learning experience? If you're doing lower extremity, surgery, then why not learn how to rule out a DVT in your patient? Say they're a trauma patient that's been laid up for several days. So we're teaching DVT scanning for lower extremity, for abdominal and truncal blocks, evaluating gastric ultrasound to assess for aspiration risk. And so with each workshop, the anatomy that we're teaching when it comes to performing those ultrasound guided blocks, we're also integrating how to use diagnostic ultrasound, and I think it's a normal and natural fit, and it translates very well into our current workshop setting.
Yeah, I think that people don't understand that. Some people get confused. Why is POCUS at an Azure Pain Medicine meeting? And I think you've elucidated it really well, which is that both that we have the skill set with the equipment, but we're also right there. We're already looking at the anatomy in that region, and that added piece of information is probably integral to whatever the next decision making needs to happen. I think that's part of what people don't understand is that regional anesthesia, acute pain management, we're not trying to isolate it away from the overall care of the patient, but rather integrate it back into the overall care of the patient. And POCUS is definitely a part of that, and I think it's a really important part to keep integrated into the whole learning experience as well, so that people don't think of it as a standalone skill set. Let's talk about some of the fun stuff that's going to happen at this meeting. So there's obviously social events, networking opportunities. I mean, we hear over and over and over that networking is one of the main reasons people like to attend the in-person meetings instead of just virtual meetings. So you want to give us a hint, Steve, a little bit on some of the networking opportunities? I've got some in my mind that I want to highlight too.
Yeah, so Thursday night we have our typical happy hour, and you're always posted up and interviewing and doing a great job of creating as much FOMO as possible for anyone and everyone who made the silly
Nobody
choice
should have
of not
FOMO
attending.
this time, because they should just be there, right? There's no
Exactly, just
FOMO
show
if
up.
you're already there.
But so that's always a great opportunity. And then we have our president's luncheon that will occur on Saturday. And because this is our 100-year celebration of regional anesthesia, we have a wonderful Roaring 20s themed celebration that's happening on Saturday night. I do have to share the unfortunate news, which is the tickets to that event have sold out. But we do also benefit from having invited every single living past president and Gaston Labat award winner to the meeting, and 18 of them, many of them are actually dual recipients, are going to be attending, presenting, participating. And so what better way to spend your time than to interact with some of the regional anesthesia greats and pain medicine greats of the recent decades and in our lifetime. So it's a lot of great opportunities to network, and also with each other, both in
Yeah, I think the
workshops
key
and
thing
in
is
the
even
hallways.
if you can't come to the dinner, those people are going to be roaming around, right? They're going to be in the lectures, they're going to be speaking. These are some of the people that not only have been leaders in the organization, but definitely leaders and innovators in the fields of regional anesthesia, pain medicine, perioperative medicine, and probably the articles and book chapters that you've always read. They're the ones that were writing that stuff and innovating all of this material. So it's one of the unique opportunities that we have this year is that we've really kind of encouraged them to come back to the society and present on some of their knowledge and experience and wisdom on the specialty and where it's come from. And there are videos, actually. If you guys go to the website, there's a section on the 100-year anniversary. There's interviews with a lot of the former recipients of these awards talking about their time in the society and what they remember about the specialty. And I think it's a great way to learn about what we're doing now, is to have context of the history of how the challenges they surpassed. Really, it's remarkable how far we've come in a very short period of time. And how precise and expert this specialty has become. The other thing is also the fellow meet and greet. So, I don't want to discount, like, that thing is packed every year. The meet and greet for the fellows. If you guys are out there listening, your fellows, residents, are interested in this specialty, I mean, this is like a great opportunity to literally rub shoulders with your colleagues, but also the people that run the programs. The fellowship directors all attend there. It is there's snacks and drinks and really good socializing and opportunities to find people. And if you're really interested in a program, go up to that program director and shake their hand, because what a fantastic opportunity to kind of put a face to a name on both sides of the equation, because the fellowship directors really want to meet the applicants as well. And I guarantee you it strengthens your application on the other end too, is that you took the effort to come and meet them. So Thursday night there's an event, Friday night there's the meet and greet, Saturday night there's the dinner, Saturday lunch there's the luncheon and the award ceremony, and then just through the hallways up and down there's networking opportunities throughout the meeting. I don't want to drag this on too long. There's so many things at this meeting. Steve, I'm going to give everybody a chance to kind of just highlight one thing that they're excited about. The meeting's coming up in a month. Gary, I want to start with you. Is there something that you're like, oh man, I can't wait to be at this meeting and talk about this, or see this, or say hi to this one person, or whatever it is?
I'm excited, obviously, for the cryo that Nadia and Angie are doing, and I'm really excited because I got to interview a few of the past Labat and ASRA presidents, just to see them all in a room in one place and all that they've had to deal with to help further the specialty. To see where we're at now is going to be really exciting, and just to shake Steve's hand. He's been a longtime friend, but just the great work just organizing this fabulous meeting.
Awesome. Nadia, you have any thoughts? What's really exciting you?
Yes. Well, I always get excited to see my regional anesthesia family because we are a very small group and we're tight knit. But particularly at this meeting, we have some special guests coming from overseas. And so I'm really excited to see the international faculty at this meeting. We don't get to see them as often in person. I know we do a lot of Zooms and collaborations online, but it's going to be really nice to actually see them in person this time around. So that's one of my, and having all these Spanish stations is really
we didn't even talk
so
about
awesome.
that.
I know this.
Yeah, you want to mention that a
I'm
little
really
bit?
excited about Go ahead, Stephen. This is your.
Steve, yeah, talk a little bit
This
about that
is
because
your
we
baby.
skipped over that part.
Yeah, well, we're very fortunate. We have the president of LASRA, Juan Carlos de la Cuadra, will be attending the meeting, and he'll be presenting, and he'll also be participating in a bilingual uh, interactive session. We'll be talking about the role of ultrasound guided regional anesthesia in Latin America, and the impact of ACGME accreditation in the U.S. for our fellowship, and how that's impacted. Applicants from Latin America trying, come to the U.S. for fellowship. And so, we want to engage with their society in a meaningful way, in the way that they have engaged with us. And so one of the concerns is often, the inability to actively participate in workshops because of the language barrier. And we have multiple faculty within ASRA who are fluent in Spanish that were generous enough, Nadia included, to be willing to host a station where they would teach in Spanish. And so we do have some stations that are available for Spanish speakers to sign up and be in that workshop and be taught in their native language, so they can learn in the same capacity as the English learners.
Yeah, I mean, just what a creative way to build bonds. I mean, one of the things that most people probably realize is the American Society of Regional Anesthesia and a lot of our European colleagues, we've had a lot of relationships over the years, and that relationship has strengthened in the last 5 or 6 years quite a bit, where there's a lot of cross education and meetings and speakers. But our Latin American society is also growing in strength and interest in this specialty. And I mean, there are neighbors to the south, and I think that there is a lot of interest in both sides of building and expanding that relationship south of us into Central and South America. And I think that this is really the kickoff part of this is to show that we're committed to sharing that relationship and finding ways of educating in innovative ways. So I really appreciate you guys putting all that together. I think that's fantastic. Stephanie, things that you're excited about this meeting. I mean, what jumps out at you? Obviously, your session is going to be really cool. I mean, we're excited about that, but what are you excited about?
Obviously, that's the only thing I'm excited. No, I'm excited about. I'm excited about the whole meeting. I mean, this whole idea of diversity within the field, and outside of the field. I'm actually, this is more of a personal side, but one of the people that I actually did residency with, he's going to be doing one of the special sessions on Saturday, the challenges and advantages of being a disabled physician with Fermi, and we actually hung out all the time before his accident. So we'll get to hear a little bit about, what his journey was like after that and how it sort of changed his trajectory for his career. And I'm just so excited to see an old friend and all the old friends, the ASRA community, just like Nadia said, it's a little family. So we get to see everybody.
Yeah. It's old and new friends combined, you know, and the friend group keeps growing, which is great. We rarely kick anybody out, except we did manage to kick Angie off the call somehow or another, but she's still our friend. So she's just off the podcast at the moment.
She apologized. She had bad reception. Don't forget
No,
about
I
the
know.
fun
I got a
run in the
text
morning
message.
too, Raj, in case anyone
Yeah.
wants to join.
There's
there.
a fun run if anybody wants to join. And it's probably going to be just gorgeous weather. So this fun run on Friday morning, 6:30 a.m. And you can walk if you want to. But I think, Steve, I think the plan was to do it on the beach. Isn't that right?
That's right.
So-
You can have your chariots of fire moment and go for a nice little mile jog on the beach. It's not usually we do like a 5K, but it's a little bit harder to run in sand.
Harder on
So
sand.
so barefoot or in your shoes, but out on the water, it's going to be a really beautiful and I think a super memorable moment for anyone who's interested in joining on Friday
That's
morning.
awesome. I think we're going to have quite some fun with a lot of splashing probably going on in the fun run in the morning. So anyway, Steve, last thoughts before we wrap up. Anything that you're really excited about? I mean, other than the fact that like this effort that you've put into so many years is finally going to come to fruition and you get to see your baby being born on this April day. What else are your thoughts?
Well, I I just want to add, the 100-year theme kind of was a little bit of a curveball that came, towards the end, because I think it was one of those moments where Azra Pain Medicine realized, wow, like this is a really sort of important and momentous occasion for us to celebrate the original formation of Azra and all that Gaston Labat has had, has brought to our society. We're fortunate to have a member of his family that will be attending the meeting and will be involved in presenting the current award, which will, I believe, be going to Suresh for his contributions for pediatric regional anesthesia. There's a large diversity, equity, inclusion component to the meeting. Stephanie was just, alluding to us having, a physician advocate who also, is disabled, and will also have someone who works locally in Florida advocating for disabled patients, and they'll be having a very meaningful conversation about the challenges that disabled patients face routinely in the healthcare system. You'd think that the healthcare system would be designed for them, but there are a lot of barriers and challenges that go along with it. And Framni's a little bit of a star. He was highlighted on Good Morning America recently and won $1 million to support his foundation, which is bringing athletics to disabled patients and really making a meaningful impact in their lives through athletics. He was a former athlete before his tragic accident that left him paralyzed. So, we have just a lot of really powerful and exciting and moving opportunities, and also just really great education. Safety is being highlighted in addition to pediatrics and obstetrics. We have the president of the ASA and SOAP and LASRA and RAUK and so really it's
so much.
Thrilled to have such a action-packed and quality meeting, and I'm just gonna soak it all in.
Yeah, I'm really excited to see the discovery on people's faces when they come to the meeting and realize how much there is there. There's so much depth and variety and innovation and inclusion, diversity, all of those things. That's why we take so long to plan these meetings, is because there's very well thought out with a lot of people contributing. And I just can't wait to see other people's faces when they're surprised by how deep this meeting is. It's not just an education meeting. It's a professionalism meeting. It's a faculty development meeting. It's a networking meeting. It's a socializing meeting. It's all of those things. And so I really encourage you, if you haven't gone, ASRA.com, go to the meeting page, register for the meeting, sign up for all the workshops, because they're going to fill up before you know it. Make sure you're there. Get your flights booked. I think you're going to have an amazing time. And I do want to thank all of you guys for joining me today. I can't wait to see it. So it's just like 3.5 weeks from now, we'll see each other in person. And that's really exciting for me. It's like returning back to summer camp every year. So get to see my old buddies at camp. So I'll see you guys soon. And with that, we'll sign out, and make sure you go to the website and register for the meeting. Thank you, everybody.